Before we learn first-pass metabolism, let's answer one important question. Which dosage forms actually pass through the liver first? Oral tablets, capsules, syrups, suspensions. These are absorbed from the stomach and intestines, travel through the portal vein, and reach the liver before entering the rest of the body's circulation. That means they undergo first-pass metabolism. But many other dosage forms bypass the liver at first, including intravenous, IV, intramuscular, IM, subcutaneous, SC, sublingual, buccal, inhalation, transdermal patches, most nasal sprays, most topical preparations, most eye and ear drops. And one important exception, rectal suppositories only partially bypass first-pass metabolism, but depending on where the drug is absorbed. So here's the question. Why do oral medicines lose part of their dose in the liver, while injections or medicines under the tongue don't? Let's find out. Imagine swallowing a tablet. You expect it to start working immediately. But what if I told you that before the medicine even reaches the rest of your body, a large part of it is destroyed? Sometimes 50%, 70%, or even more is broken down before it can help you. This process is called first-pass metabolism. And understanding it explains why some medicines need much higher doses, or even why some can never be swallowed. Let's make it simple. Think of your medicine as a traveler. When you swallow a tablet, it doesn't go straight into your bloodstream. Instead, it follows this path: mouth, stomach, small intestine, portal vein, liver, bloodstream, target organ. Notice something important? The liver comes before the medicine reaches the rest of your body. That's where the problem begins. The liver is like a giant security checkpoint. Its job is to inspect everything coming from your digestive system. Inside the liver are powerful enzymes. These enzymes start breaking down many medicines. This happens before the drug reaches the body's circulation. That's why it's called first-pass metabolism, because the drug is metabolized during its first pass through the liver. As a result, less active medicine reaches the bloodstream. Imagine taking a 100 milligrams tablet. If the liver removes 60 milligrams during the first pass, only 40 milligrams reaches the bloodstream to produce its effect. This is one reason why some medicines need larger oral doses. It's also why the same medicine may require a much smaller dose when given by injection. Different route, different amount reaching the body. Some medicines are affected much more than others. Examples include nitroglycerin. If swallowed, most of it is broken down before it can work. That's why it's usually placed under the tongue, where it enters the bloodstream directly and bypasses the liver. Other examples include Propranolol, Morphine, Lidocaine, Verapamil. These medicines experience significant first-pass metabolism. This is also why you often hear another important term, bioavailability. Bioavailability means how much of a drug actually reaches the bloodstream in an active form. The greater the first-pass metabolism, the lower the bioavailability. So remember this simple rule: high first-pass metabolism equals low bioavailability. Here's the entire concept in one sentence. When you swallow a medicine, it travels through the intestine to the liver. The liver breaks down part of the drug before it reaches the rest of the body. This process is called first-pass metabolism, and it reduces the amount of active medicine entering the bloodstream. Now you've learned one of the most important pharmacology concepts in just a few minutes. If this made pharmacology easier to understand, subscribe for more simple medical lessons.